Welcome back to another episode of Top Tech Growth Hacks. I'm Alex.
And I'm Jamie. Today on Top Tech Growth Hacks, we're diving into a super crucial but often overlooked area, medical device software development, specifically in the thriving Boston MedTech scene.
It's a fascinating topic, Jamie. Boston, as many know, is a hub for medical innovation, boasting more medical device engineers per square mile than almost anywhere else. Yet the article highlights a significant challenge for MedTech founders.
Absolutely. You'd think with all that talent, finding a software partner would be easy, but the real struggle is finding one that can handle the entire regulatory gauntlet under one roof: ISO 13485, IEC 62304, and HIPAA-eligible cloud architecture. That's where clearance timelines slip and crucial Series A funding can just evaporate.
It's a huge pain point. The article really emphasizes why MedTech teams need a strategic partner, not just another vendor. Trying to build that software stack in-house means hiring a regulated software lead, a QMS owner, a cybersecurity specialist, a cloud architect, and then waiting a year before anything meaningful happens.
Exactly. A strategic partner brings all that capability on day one. They build to standards like IEC 62304 and ISO 14971 from the start, so you're not retrofitting design history files later. They handle HIPAA-eligible cloud infrastructure, integrate device firmware with EMRs using HL7, FHIR, and DICOM, and even manage cybersecurity threat modeling. That seriously shortens the path to FDA clearance.
That's a game changer for startups and established companies alike. The article then goes on to list 8 firms in the Boston area that are actually closing this gap. It's a great roundup.
It really is. They cover a wide spectrum. For example, you have companies like MedAcuity, which specializes in software for all classes of medical devices, including surgical robotics. Then there's Auriga, with nearly 2 decades focused on embedded software for safety-critical devices like ventilators and infusion pumps.
And Leaf Labs, coming out of MIT, really goes deep on firmware and custom IoT systems for connected medical devices, which is a critical, often challenging part of the stack. Boston Engineering offers full lifecycle product development, integrating software, electronics, and mechanical engineering.
But if we're looking at a firm that really stitches together the whole hardware and software story, Glorium Technology stands out. They're ISO 13485 certified, excel in SAMD, IOMT integration, and AI diagnostics. They've built over 150 products, handle all the compliance like HIPAA, HITRUST, and GDPR, and are an AWS Select Tier partner.
That's impressive. Their focus on firmware to cloud pipelines and integrating AI ML for diagnostics, along with EMR integrations, really makes them a full-stack player. They've got the track record to back it up too, being on the IAOP Global Outsourcing 100 for years.
They really do seem to cover all the bases, especially for connected devices, companion apps, or SAM submissions. The article emphasizes that choosing the right partner depends on your device's current stage and regulatory pathway.
Absolutely. The key takeaway here is to look for verifiable evidence, active ISO 13485 certification, documented IEC 62304 processes, actual FDA submissions they've supported, and a security posture that can pass a hospital procurement review. Cutting corners on hourly rates will always be dwarfed by the cost of compliance gaps.
A powerful reminder for any MedTech founder out there. It's an investment, not just an expense. This has been an incredibly insightful look into a very specialized area of tech. Thanks for breaking it down, Alex.
My pleasure, Jamie. And thank you all for tuning in to another episode of Top Tech Growth Hacks.
We'll catch you next time on Top Tech Growth Hacks.